Hi, I'm Shimon and I'm in S1.
And I'm Eshin and I'm in S3 and today we're going to be talking to Linda.
I have been a vaccinator for several years now, and within that time I have vaccinated thousands of individuals, from babies receiving their primary vaccines to school-aged children, young adults and the elderly. But today we'll focus on the vaccinations that you're going to be offered within secondary school. I'll try and give you a little bit more information, answer your questions that seem to be the most common ones, and bust a few myths that do surround the vaccination programme.
To kick things off, I really don't like needles or injections. Will it hurt?
This is a really common question, if not the most common, all right? And the simple answer is no, the vaccination should not hurt. We like to describe them as a small pinprick to the skin, okay, in the upper arm, because it's really small needles that we use. We have very experienced, highly skilled vaccinators that are administering these vaccines, and it's over within seconds. Some people do find it similar to getting a piercing if you've had one. It is a really common worry for people, and especially at your age when it's been such a long time since you've had your last set of vaccines. So please do discuss with the vaccinator that is there. They can offer any reassurance and support for you prior to the administration of it.
I want to get vaccinated, but my parents aren't sure. Do I need their permission?
What I would say is we would actively encourage you to have open and honest conversations with parents and guardians at home around the vaccines and try and come to a mutual agreement together before you sign your consent forms and before you come along for the vaccines. But if you are under 16 and you want to consent to your vaccines, you can speak to the vaccinator, and if they feel that you fully understand what you're coming along for and you understand any potential risks and the benefits, then you can go ahead and get vaccinated.
I had loads of vaccines when I was younger. Why do I need more?
You're right, you did have lots of vaccines when you were younger. We start the vaccination programme when you are babies, but it's highly important that we come back in when you're in secondary school to sort of top up that immunity that you've already built against these life-threatening diseases.
Do I need to get these vaccines every year like I do with the flu?
So no, you don't. These will likely be your last routine vaccines that you've had to boost your immunity before you leave school. That's why we actively encourage you to come along when you're offered the vaccine. You may find as you get older, and anyone with potential underlying health conditions will be called later in life if they are eligible for further vaccines.
Why are these vaccines given in secondary school? Can I put them off until I'm older?
So we offer the vaccines in school to continually protect you before you leave school. We want to boost that immunity that you've already got to provide you with a long-term protection. And we want to do that before you do leave school and go into jobs, potentially go to college, university. And for those that might want to travel the world and go to these areas of the world where these diseases are more common, we want to protect you before you get there.
I've never heard of these diseases this vaccine protects me against. What are they?
The vaccine that we offer to boost your immunity protects you against life-threatening diseases like diphtheria, tetanus and polio. And I find this question quite interesting because on one hand, I think it's good that we don't always know a lot about these diseases, because that means that our loved ones at home, our friends, our families haven't contracted these diseases. And that is because we have been vaccinating them. And almost we've got rid of these diseases within the UK, and we want to keep it that way. So that's why we want to continually encourage you to come along, get these vaccines to make sure the risk of these diseases coming back isn't there.
I've seen loads of stuff online about vaccines. What should I believe?
I really appreciate that there is a lot of information out there, and it actually can be quite overwhelming, especially with our social media platforms that we have and our open public forums where we can have conversations back and forth with people. What I would say is if you are looking for information, you should go to trusted sites such as our NHS Inform. On here, the information has been developed from healthcare professionals such as your doctors and your nurses. It's all evidence-based and it's continually updated. If you had read something and you're wanting a little bit more information, please do speak to the vaccinator that comes along to the schools, and they can offer you any more information, guidance, support that you need before you make the decision of your vaccine.
I didn't know boys were eligible for the HPV vaccine. Why do we get it?
HPV is very common and likely at some point we will come into contact with it, but it doesn't often show symptoms. So this is why it's vitally important that all those that are eligible come along for the vaccines to prevent any future risk. We do know that HPV can cause certain cancers such as cervical, head, neck and genital, so it's vitally important that you do attend.
Is there really a vaccine that can protect me against cervical cancer?
So the HPV vaccine that we offer, we know that the HPV is the most common cause for cervical cancer. So this is why we highly encourage you to come along, be vaccinated against this. Having said that, the HPV vaccine does not cover all types of HPV. We also do recommend that as you do get older and you are called to attend your cervical screening appointments, that you do so for that as well.
Thank you so much, Linda, for chatting to us today. But what if we've got more questions? Where should we go?
If you're looking for any further information surrounding the vaccines, please do visit our NHS Inform website. There is lots of information out there for you. You can also ask your teachers to gain some more information, and please do speak to our vaccinators when they do come into your school. They can offer any further support and guidance surrounding the vaccinations you're being offered. Can I also lastly leave you with, please remember to sign your vaccine consent forms at home with your parents and guardians and return them to school before the teams come in to do their vaccinations.